Well, today with Hoag, we have an interesting topic to speak about. We have Dr. Michael Hurwitz today, who is a medical director of the Hoag Wound Healing and Hyperbaric Medicine Center. Nice to have you here today.
Thanks for having me. Appreciate it.
And obviously today we're talking about non-healing wounds and what happens and why is that caused? Is it a chronic condition, or what makes a wound not heal, and what type of wounds are we talking about?
Well, normally when somebody sustains an injury or has a wound, it heals in a very orderly fashion.
Right.
You cut yourself and it heals. But there are occasions when you can have a wound that doesn't heal for a number of reasons and becomes chronic, and no matter what you do, it doesn't go away. And that can be a real source of frustration for people. Obviously, it can be painful. And so when that happens, when people develop wounds that aren't healing the way they're supposed to, they come to us and we help heal their wounds.
Okay, and can this be any kind of wound? Are we talking about you get a cut on your hand, or is it something that is more severe than that?
Well, there's a number of different things that can happen. Some patients are more susceptible to certain wounds, particularly patients with diabetes. What would seem like a small, trivial wound, perhaps an injury on a toe or on a leg, can turn into something that takes a very long time to heal, is at risk of becoming infected. And so those are the kinds of things we see. We see patients with a history of varicose veins, for example.
Okay.
They'll have chronic wounds related to their varicose veins. We also see people that have acute injuries, particularly older people can sustain skin tears. They can bump their arm on a piece of furniture or bump their leg on the dishwasher, and that can turn into a flap of skin that can be a real problem, and so we help them heal those quickly as well.
Another question that goes along with that, you talked about aging. I imagine it's certainly true that just because we age, our wounds don't heal quite as fast. I know if I get a little cut on my hand, it certainly doesn't heal at the same rate as if my young daughter gets a cut on her hand. It'll, 3 days later, she's done with it. For me, it takes 2 weeks. That's normal,
Exactly.
just aging process?
Well, and we certainly see that in older patients, and older is really anybody that's older than me. So somebody that's older, they get a wound and it just takes a long time to heal. Their skin doesn't have the cell function that it once did. And that's not to say it doesn't heal. We can get it to heal. We have a lot of tools at our disposal to get wounds to heal. We have a big multidisciplinary team of people that help this process. We have doctors, we also have nurses and physical therapists that see patients using very advanced modalities in many cases to help get these wounds to heal.
So when should someone determine that it's time to go see probably their primary care physician at first if a wound is not healing? If it's does it stay kind of open, or maybe some discharge from it, or pus or something like that?
That's correct. So certainly any sign of infection, if you've got redness around a wound, if you've got something draining from the wound, if you're worried that a wound that seems minor just isn't getting better, then you should see your doctor, and hopefully your doctor will send you to us, and we're there to help get this process going. A chronic wound is a wound that hasn't healed in 6 to 8 weeks, but you don't have to wait 6 to 8 weeks to come see us. We'd prefer if you come see us sooner and get in, and we can help get this process going and get you out the door faster and avoiding things like infection and problems down the line.
What are the healing rates for having at the wound center?
Well, we've been compared to 800 similar centers across the country, and we are at the top of the list. We've received national recognition for our wound healing rates. We heal 95% of wounds. We beat the national average by 7 days, so we're really on top of our game there. We've been in business at Hoag Newport for the past 5 years, taking care of chronic wounds, and now we've opened a center at Hoag Irvine, which is much closer to Laguna Woods, and we're ready to take on new patients and help heal.
So you have a real dedicated team that at this particular medicine center that this is what they focus on.
That's correct.
Now, years ago, did they look at wounds as seriously as they do now? I can't remember years ago hearing about wound healing centers. Is this something that's come about maybe the past 10 years or so?
Well, I think taking care of chronic wounds has developed more into a subspecialty. It's really developed into its own discipline. And I don't think several years ago there were the tools to take care of these things.
Yeah.
And I think people did their best, but we saw, for example, with diabetes, we had higher rates of amputation because trivial wounds would become infected and wouldn't be taken care of until, in many cases, it was too late. So as technology evolved, as we developed new tools to take care of wounds, this has really burgeoned. We've got hyperbaric oxygen therapy in many cases. We've got new engineered skin substitutes that we can use to help expedite wound healing. So as the technology's improved and as the science has improved, this has developed into its own discipline.
What does a hyperbaric do? Is that the actual, like a chamber you lay in, or you put your arm in and it just does that?
So hyperbaric oxygen is delivered in a chamber, as you said. It comes from treating the bends in scuba divers.
Sure.
So it's a way to deliver oxygen at greater than atmospheric pressure. So it's the equivalent of swimming to 33 feet below seawater and breathing pure oxygen.
Okay.
So you're infusing the body with oxygen. You're exceeding the carrying capacity of the hemoglobin molecule in the blood to carry oxygen, and you're infusing the plasma with oxygen, and it really helps heal wounds in many cases.
You mentioned diabetes, but what could be the other causes of somebody's wounds not healing properly? Could it be medications that they're on, blood thinning medications, things like that?
Well, blood thinning medications are so important that we really encourage, if somebody's been prescribed blood thinning medications, that they stay on them. And those in and of themselves don't prevent wound healing.
Okay.
But certainly there are many illnesses that do. Diabetes is one. Peripheral arterial disease is another. Patients who are smokers have a greater risk of chronic non-healing wounds, or people that have blood vessels that aren't carrying enough blood because of arterial sclerosis. Patients that have had radiation for other things, that radiation can damage the blood vessels and damage the cells that help heal. So those can be very difficult wounds to heal. Patients that have certain rheumatologic conditions or autoimmune conditions. And as you said, patients that are older can have a tough time healing.
Okay, so again, it's something that if someone is noticing something is not healing properly, again, most part, their first step is going to be seeing their physician, and then from there, I would assume that physician needs to determine, okay, this is something that needs to go further and get expert treatment and specific treatment.
That's correct. Or they can call the wound center.
Okay.
And they can call the wound center and make an appointment. We're in Irvine now on Sand Canyon.
So they can call directly.
So they can call directly. Now, there are some patients that require a referral. It depends upon the insurance circumstances. But we can help direct them to that as well. So
great.
If you have a wound that you're concerned about, then I think you should be calling us, and we can help direct you.
All right, very good. And the website, by the way, is easy to remember. It's hoag.org/wound care. There's the number on the screen, 949-557-0100. Doctor, it's been a pleasure.
It's my pleasure.
Nice to meet you. And it's great that you now have this location right down the street up on Sand Canyon. So fantastic.
Thank you. Thank you.
Pleasure.
Very much.
All right, we'll be right back.